So what we're going to do tonight is talk a little bit about Social Security and Medicare. And we're going to talk about these social insurances. They're a very big part of our economy. They're a very big part of your financial plan. And every one of you here tonight, even those who are a little younger, will be getting some kind of Social Security. It'll probably look different than it does today. I'm 42. I'll probably receive Social Security as it looks today, though maybe a little diminished. So I don't think Social Security is something you need to count out. If you remember last week, Dave Blanchett also addressed the issue. He said, likely Social Security changes. Perhaps we tax more, which I think is the likely outcome. Maybe we raise the full retirement age. Those are probably the two realistic ways to fix this system. It does currently is going to be insolvent in the next decade, so there has to be a fix between now and then. I mean, there's just no way to have an insolvent system. So from that end, Social Security currently is paying out more than it brings in tax revenue. So it will soon exhaust its surplus, and at that point, decisions will have to be made, tough decisions. Decisions that I, as a student 20 years ago in a classroom just like this one, had to talk about. I said, well, it's gonna break. Well, now it's breaking. When you get there, it will be broken. So verb tenses in Social Security, kind of what we're looking at tonight. Now, that said, it is the backbone of retirees, and the reason we don't have a retirement crisis, according to Blanchett last week, that's why we don't have a retirement crisis, is that we have Social Security. So let's start a journey tonight, and I want to focus in on this slide, and it's not the perfect slide. It came from CFP Materials, my buddy and I work with. But what I wanted to show you is, look, this is how much you get when certain things happen to you. And there's three categories of events that would trigger Social Security benefits occurring. You need to be aware of these three categories of events. We're going to quiz you on them, but more importantly, just in life and as a financial planner, these are going to be important for you to be aware of. So number one, retirement. There will come a day and time where you retire, you file for retirement with Social Security. You can file as early as 62. Everyone in this class, your full retirement age is 67, though if I had to bet money on it, by the time you get here, it will be 70 or 72. Okay, so that's the first event that triggers a Social Security benefit, is retiring. The next event that triggers a Social Security benefit is dropping dead. So survivorship is the second, and in other words, you're dead, and people that counted on you receive benefits. So you've dropped dead, but others receive benefits. And then lastly, disability. Disability, if you're disabled according to Social Security guidelines, which means that you cannot perform any occupation you're suited for, then disability insurance will pay a benefit. So we have retirement, survivorship, and disability, and these are the three events that occur that trigger a Social Security payment. Now, does everybody get a Social Security payment? What do you think, team? Let's vote. What do you go to that chat box? Humor me in the chat box. Does everybody get a Social Security payment? Does everyone get a retirement payment in the U.S.? Everyone going to collect when they retire? Go ahead. Use that chat box. What do you think? Chat box me. Go ahead. Catherine, if you got your audio, we'd love to hear you, or you can vote in the chat box. But everyone else, come on. Tell me what you think. What do you think? Everyone going to get Social Security benefits? All right, we have a vote for no, but yet 10 other people. Yes, Cole, come through for me. Yes, very good. All right, the answer is no. About 95% of Americans receive Social Security benefits. And the other 5% are covered by programs that are exempt from the Social Security system. All right, any ideas on what is an example of exempt employment? What is an example? When I say exempt from the system, what are some jobs or employers that tend to pay into their own systems instead of Social Security? So who pays into their own private systems and not Social Security? Some school districts, that's correct. Some school districts do. All right, anyone take a shot? There's a university that does. Anyone want to take a shot? What university that is? Let's take a pop at that one. You want to take a shot at it? Big university, you go there. All right, any takers? Big school, right. Illinois has a state system that they pay into, and so Illinois state employees then don't pay into Social Security. So instead you're paying into the state of Illinois system and not Social Security as well. All right, so it really depends on where you work, but generally speaking, there are some nonprofits, the railroad engineers as well. Railroad engineers pay in. Federal government employees pay into federal government retirement, right? So we pay into federal government retirement. And in the end, you wind up with somewhere in the neighborhood of about 95% of folks paying into the Social Security system, which means not everybody does pay in the Social Security system. But the Social Security system covers a majority of private, those that work in the private sector, okay? Those that work in the private sector is what we're looking at there. Thank you, Mark. So those that work in the private sector are going to be the employees who are covered by Social Security. So this does impact most Americans, and as a financial professional, it's going to impact most Americans you work with. So with that in mind, retirement. We're going to kick in. What does retirement mean? Well, for you to receive retirement benefits, you must be what's referred to as fully insured. And fully insured means that you work 40 quarters on your path to being insured, although there's an additional way to get fully insured if you're younger, and I'm going to cover that when we get to the survivorship benefit. So being fully insured, we generally mean you work 40 quarters. And what that means to Social Security is, as we'll see in the slides a little later, there's a de minimis amount you have to make a year to qualify as a quarter, and you have to work 4 quarters in a year, right? So you have to work 4 quarters per year to get a credited service. After 40 quarters, you're considered fully insured. Now, there is a definition for fully insured and survivor that hits younger Americans, makes it easier to qualify if you're younger. But generally speaking, when we talk about the older Americans, those that are to retirement age, we're generally looking at that. Okay, so fully insured means 40 quarters, and that's where we're headed with Social Security. So if you do have 40 quarters of coverage, what does that mean to you? Well, if you have 40 quarters of coverage, it means if you're retired at your full retirement age, you get 100% of your primary insurance amount, or PIA. You get 100% of your primary insurance amount at your full retirement age. But Craig, I want to retire early. Okay, you can retire early, but if you retire early, you get it dinged. In fact, it goes dinged down to 70% of your primary insurance amount if you retire at 62. And that's the earliest you can retire. Those of everyone in the classroom today, with little exception, 62 is the earliest you're going to be able to retire. So that 70% of your primary insurance amount, if you retire early, you get 100% if you retire on time. Does anyone know what happens if I delay retirement? What if I don't take Social Security at 67? Anyone know what happens? What happens if I delay? So I wait 68, 69, 70. What starts to happen? You get a little something. Boom, you get a raise. Thank you, Mark. If you delay, you start taking it at 70, but if you delay 68, 69, 70, you get a bonus, right? So there's an incentive built into the system for you to delay receiving your benefit. All right, now, so you retire, and who else gets benefits on your earnings record? Well, the general rule is, does someone depend on you? And if so, then they can maybe access your benefits, maybe not. This chart puts it all together. So if you have an unmarried dependent child under 18 when you retire, that person can collect 50% of your primary insurance amount. So if you're getting $2,000 a year, they could file and get $1,000 a year. So I call this the David Letterman effect. As David Letterman, I think, had a baby a few years ago, and he's in his 70s. So that baby would qualify on David Letterman's earning record. That baby could then receive Social Security benefits. If you have a spouse with a child under 16, that spouse is also entitled to receive benefits, even if they're not old enough to receive them in a traditional way. So in that case, you could have the David Letterman effect spouse drawing benefits too. So there's another $1,000 a year. Though fear not, those of you that are tax conscious and on the Republican conservative side of the coin, there is a family maximum benefit that will kick in soon. Now, aside from having a spouse with a child under 16, for the majority of Americans, that's not the case when they get to be 67. So we have a situation like this. We say, okay, can my spouse draw on my earnings record? And the answer is yes, they can draw on yours or theirs, whichever is higher. And as far as yours go, they can draw up to 50% of yours. So if your spouse is 67 and you're 67, that spouse can draw 50% of your benefit or theirs, whatever's higher. If the spouse takes early, they could draw 32.5% of your benefit or theirs, whatever's higher. And of course, they can't draw. They have to wait till they're 62. And dependent parents are out of luck. They do not get to draw on your record. So this is your retirement record, and these are the people that can draw off of it for Social Security. All right. Little interesting note on divorced spouses. Divorced spouses, if you're married 10 years or longer, you can draw on your divorced spouse's record. So if you're married at least 10 years and you get divorced, there are some remarriage considerations. We covered those in the last slide today. But 10 years and you're married 10 years or longer and you get divorced, well, your ex can draw off of your retirement record or theirs, whatever is higher. So that's how retirement works for Social Security. And retirement is the optimal situation where you have 40 quarters paid in. But what happens if you don't quite get there? Okay, so what happens if I drop dead? Well, if you drop dead, we kind of have an interesting model occur. If you drop dead, one of two things is going to happen. One, you're going to be considered currently insured, which means that you've been paying in, but not quite long enough. Or two, you're considered fully insured, which means that you've been paying in the system on a regular basis. So the way that we look at for fully insured, generally we're also looking at 40 quarters of coverage. There's also a formula that kicks in if you're young. It's 1 year for every year you're, excuse me. You're looking at 1 year of coverage. I think Catherine's coming in today to save me on that. For every year you're over 26. Go ahead, Catherine. Okay, well, for fully insured here, we're looking at 40 quarters, or for younger employees, there's a mechanism that we can find a fully insured amount that's a bit younger. We need to work 1 quarter for every year we're over 22. Currently insured for survivor benefits, currently insured, what we're going to have there is that you have to work at least 6 quarters of the last 13 quarters. So that's what we call currently insured. Currently insured is 6 of the last 13 quarters. So if you drop dead, we're going to consider one of these two things. You're either fully insured or you're currently insured. If you're fully insured, any kids you have can draw 75% of your primary insurance amount, and any spouse that you have can draw 75% until the kid turns 16. So we have something called a blackout period, because your spouse can draw benefits, right? Your spouse can draw benefits. They get 75% of your PIA. That's correct, Catherine. Yes, that is correct. Well, no. Each spouse receives, okay, so just to be clear, you can receive 100% of yours at 67, and your spouse can receive either 100% of theirs or 50% of yours, whichever is higher. Okay, so you get yours, and then the spouse can determine what they get from that end. So if I wasn't clear, sorry about that. All right, so if you're fully insured at survivor benefits, you put in 40 quarters, or you put in 1 quarter for every year you're over 22, and then you wind up saying, look, I'm fully insured, so here's the deal. If you have an unmarried kid, the kid gets 75% of your PIA. If you have a spouse with a kid, the kid is under 16, another 75%. And then if you're fully insured, when your spouse gets to retirement age, they can pull off your earnings record. Okay, so if you've put in your 40 quarters, your spouse can pick your earnings record or theirs, whatever's higher. So you're married, you're 50, you drop dead, your spouse gets to 67, they can take your earnings record or theirs, whichever is higher. With spousal survivorship, Social Security, we have what we call widower benefit, and we actually allow somebody to take it as early as 60. So as early as 60, somebody can take a Social Security benefit, which is pretty cool. and very reduce those you can see here. Now, the interesting part about Social Security is that, let's say you're taking care of mom or dad. They're your dependent, right? So let's say my pop moves in my house with me. If I drop dead, my pop can pick the greater of his retirement benefit or 75% or 82.5% of my benefit. It's 82.5 if it's one parent, 75 for each if it's both. This is something people don't usually know. Your dependent parent can actually draw off your earnings record. So you might think, Craig, that is a lot of people to draw off your earnings record. That seems like it could get abusive very fast. What if you have 15 children? And I would say, well, we've figured out something called a family maximum benefit. And it is kind of a complicated formula, but somewhere around 2.5 to 3 times your PIA, it caps out. So somewhere around 2.5 to 3 times your PIA, it starts capping out. So in other words, yeah, you could have 3 kids drawing Social Security, but there is a point where the government goes, okay, that's enough of that. And we're going to cap out your PIA. So there's only a maximum amount we'll pay out each month to that family. Right, so that's a survivorship benefit. What if you don't have 40 quarters? What if you haven't been working full-time? Well, if you've worked 6 of the last 13, you still get for your kiddo and a spouse caring for your kid. So that's survivorship benefit, right? So I retire, I die, and what's my third option? I become disabled. If you become disabled, you can start drawing your benefit immediately. You draw it into and through retirement. Disability has some caveats, though. We're going to cover those in a future slide. But disability is pretty rough. It's not an easy definition to get. You have to be any occupation disabled, right? Any occ disabled, so you can't do any meaningful profession for that trade or income. And the disability has to last at least 6 months and be expected to end or expected to end in death. So we're not talking about I broke my hand. We're talking about I have a cognitive injury and I now need help, right? So this is a pretty hard bar to pass, disability income. So with disability, you receive 100%. Unmarried child would receive 50, spouse would receive 50, and then your spouse could pick theirs or yours, whatever's higher at their retirement. So disability insured has its own definition because it's a very age-based thing. So disability insured, I'll go ahead and put it in the text box for you. It makes a fantastic CFP question, by the way. So with disability insured, before age 24, you've had to work 6 of the last 12. That's any of y'all in the class, by the way. Age 24 to 30, you must be covered for half of all available quarters. 31 or over, I must be fully insured and have 20 of the last 40. So it's a pretty high bar to get because you have to be fully insured and you have to currently be working, right? That's the highest bar, is the disability bar. But that's your Social Security benefits, and that's a very important part of a retirement plan because at 67, if you've paid in, and again, about 95% of working Americans have paid in, you'll get these benefits, but you got to avoid taking them early because this hit is with you for life, right? This hit is with you for life. It's not as though that hit just goes away. So, you've got to think this through. The other strategies we get into with disability are what if you have a very high wage earner and you have a lower wage earner, right? So if you have a high wage earner, you have a lower wage earner, what do you do then? Well, if you have a higher wage earner and a lower wage earner, you can go ahead and type in the chat box, Catherine. Or if you'd like to say a comment and get your audio on, that works too. If you have a high wage earner and a low wage earner, you have to do some strategy with that, right? So if you have a high wage earner, there's a good chance that 50% of their benefit is greater than the low wage earner benefit. So you have to think, what makes the most sense? And it might make sense if you can afford to delay, take advantage of that 8% bump Mark was talking about, try to max out what your benefit is, and then take it at 70. That gives a bump to everybody. And if you have a younger spouse, delaying can be one of the strongest retirement strategies there is. These pay through your life and they're inflated. As David Blanchett said last week, this is the best deal going. There is no better deal than this one. So that's just a summary benefit chart and a little more about each thing. I wanted to talk briefly about how we pay for Social Security because it's a pretty rich benefit, right? I mean, imagine for a moment you're going to pay someone from 67 to 97, you're going to pay them $2,000 a month the rest of their life and you're going to inflate that. It's a huge benefit. How do we pay for that as a society? Well, here you go. The first $128,400 you make this year, so those of you that make $128,400 or less, or even more, but the first $128,400 you make is going to get taxed, and you're going to pay 6.2% of your earnings go towards Social Security tax. So 6.2 of what you make up to $128,400. Your employer also kicks 6.2 in the pot, which means it really stinks if you're self-employed. If you're self-employed, you're paying in $12,400 on every dollar you make up to $128,400. Okay, that's this year's number. So to give you an idea, if you're self-employed, that means you're paying in $15,921 of Social Security tax up to $128,400. Now, once you hit $128,400, we stop charging you Social Security tax. We stop. Okay, so that's it. So on the $128,401 you make, there's no Social Security tax. And what this does, what this wage base does, is it does two things. One, it allows retirement plans to discriminate in an interesting way, because they can say, oh, those of you under $128,400, you were getting Social Security, so I don't have to take care of you. I just have to take care of these people who are no longer being matched at a higher income level. So it creates top-heavy discrimination in some retirement plans. But that's how Social Security tax works. So one of the theories in raising tax revenue would be to increase the basis. This number is the law. $128,400. That's the law. That's the actual wage base. So every dollar you make up to $128,400, you have to pay into Social Security. Sorry if I wasn't clear, Ethan. So $128,400. Every dollar you make up to that, you pay into Social Security. Now, Medicare is different. There is no cap on Medicare, right? There's no wage cap on Medicare. So with Medicare, you pay 1.45% and your employer matches 1.45% of every dollar you make. So say you make $1 million a year, you pay that tax on every dollar. So Medicare tax, there is no wage-based cap, right? So with Medicare tax, you're going to pay tax on every dollar you make, whereas with Social Security, you just pay tax on the first $128,400. So one of the theories to shore up the Social Security system is to increase the wage base. Well, what if we made the wage base $200,000? That would bring more tax revenue in. Well, it would, but you'll see how we calculated in a minute that the more you make, the less goes in to your own account. So there's a real redistribution of wealth that happens towards the top end of things. All right, so that's what we call Medicare. We pay Medicare tax and we pay Social Security tax. Does anyone know what we call those taxes? Those of you in tax class, anyone know what do we call those taxes? We have Medicare, we have Social Security tax, we add those up, what do we call it? What do we call it? Team FICA, yeah, call that FICA, okay? Your FICA tax. So out of each of your paychecks, you're gonna lose 7.65% of every dollar up to $128,400, and after you hit $128,400, you only lose 1.45% after that. Okay, very good, very good. Okay, good job. Now, the Tax Reform Act did not touch the Medicare tax, which was interesting because a lot of people thought it would. There is an additional Medicare tax thrown on those folks who do very well. So on top of that 1.45% Medicare tax, there's an additional 3.8% of tax you start paying if you've done well, if you're in a high tax bracket. So this additional 3.8% Medicare tax is on net investment income or AGI above certain thresholds. So net investment income would be income from portfolios, would be income from passive activities, would be income from dividends, and income from interest. So to the extent that your adjusted gross income as a single person is over $125,000, or as a married couple more than $250, I mean, excuse me, $200 for single, $250 for married, you have to pay extra tax, 3.8% into Medicare on top of everything else You got to pay extra Medicare tax. So keep in mind that as you work with more affluent clients, one of the reasons that we like using qualified plans and IRAs is that they are not subject to this additional Medicare tax, but taxable accounts are. So one of the reasons that we use things like deferred annuity products and additional tax-deferred savings vehicles is that they are not subject to this extra 3.8% Medicare tax. Whereas if you just own a CD at Busey Bank, that interest would be subject to the extra 3.8% Medicare tax. So as you get into higher tax brackets, there's an advantage for qualified dollars, retirement plans, IRAs, Roths, and deferred income things. So muni bond interest is not going to be added into your MAGI. So muni bond interest is not going to be added into that MAGI. However, the cost to get any gains on the sale of muni bonds would be. So if you have a muni bond with a step up in basis, say you buy it for 800, you sell it for 1,000, that would be subject to gains, that would be taxable. However, if the muni bond coupon would not be. Thank you, Catherine, for the great question. So Medicare tax is an extra 3.8 on top of everything else. You just pile that baby on, pile that extra 3.8% on. But it does help pay for and shore up our Medicare system. So, right, like that's a good look at that. And we call that the high income Medicare tax. So that's really what we have, and kind of getting into that earlier. More and more, this is not indexed, as we talked about on the last slide. So more and more folks are going to have to pay that over time. So be ready for that. Be ready. Okay, because you pay 1.45%, your employer pays 1.45%, then you have an extra 0.9% on top of everything else if you're in this higher wage base. So in other words, you're going to be paying 3.8% tax on your income if you're doing well. Put this in the doing very well column. If you're doing very well, you're going to pay an extra 3.8% tax on that income. And that's Medicare tax. So plan around it, plan for it. If you're working with high income earners, use things like deferred products and qualified plans and IRAs because money in those is not subject to this tax. All right, so be ready for that. So how on earth do I calculate what my benefit is, Craig? All right, that's a good question. How do I calculate that? Well, we call that your average indexed monthly earnings, or AIME. And your average indexed monthly earnings is calculated like this. First off, we're going to convert all your earnings into current dollars. So we index things up. So if you worked younger in your career, we're actually going to inflate that to come up with a number in today's dollars. So that inflation doesn't hurt you when we calculate your average earnings. And that is pretty cool. We're going to take the sum of your highest 35 years of earnings that were eligible for Social Security, and we're going to divide that sum by 420 months. Okay, and in your text on 1015 and 1016, you can actually see this example. But you take your highest 35 years in the market, and then you divide that time by 420 months, and you come up with a number. And from that, you can calculate your primary insurance amount, or how much you're going to get each month. So here we go. 90% of the first $895 counts in your Social Security bucket. All right, so 90% of the first $895 counts. Then we count 32% on your monthly income between $895 and $53.97. We take 32% of that. And then we take 15% of anything that's left. So we take anything over $53.97 up to the wage base. So what this does is it creates a system that says, look, every American who's making around $900 a month, almost all of those earnings are going to count towards Social Security. So if you're making $1,000 a month, almost all those earnings go to Social Security. Then we have a hit. Then we say, okay, on the next $5,000 or $4,000, only 32% are going to count towards Social Security. So every dollar you make, really only 32% goes towards a benefit. And then for the higher income earners, we're going to take the highest income earners, only 15% of that highest income gets added in Social Security. So the takeaway here is that when we calculate the primary insurance amount, we are going to take $895, and then we're going to take the next 32%, we're going to take the next 15%. So the maximum you can get in Social Security is only $27.88 a month. And I say only, I don't mean that in an elitist way. I just mean that if you were paying in at the 128,000 level, the most you can get out is $27.88 because it is skewed to the bottom. So it's skewed towards lower incomes. So Social Security provides a great redistribution of wealth if you look at how the taxes go in and the amount coming out when you're in higher income brackets. So that's how we calculate your primary insurance amount. Really, your first dollars you earn count the most, and additional dollars don't count quite as much. And that's something I think that as we talk about Social Security reform is pretty interesting. Because if we raise the wage base, then this last 15% bracket is actually going to be higher, and so we then have to increase the maximum PIA. Right? So that's how Social Security is set up, and the haggling and the tension points that go behind that. But that's how you calculate your earnings. So again, add up their top 35 years of earnings, divide that by 420 months, take that number, 90% of that number goes in the pot, 32% of the next band goes in the pot, and 15% of the highest band goes in the pot. The most you could earn this year is $27.88. Okay, so here's just an example. Let's say that you had a PIA of $76,000 a month. How would that look? Well, you take the first $895 and you put 90% in the pot. Then you take 32% of every dollar up to $53.97 and you put those 32% in the pot. And then you take the last bit and put that in the pot. So if $6,000 was your average earnings over 35 years, or at least your top 35 years of earnings, then that's what goes in the pot. That's how you find your Social Security benefit. Right? So in this case, you get $23.36 per month if you retire at what, team? Pop quiz, what do I need to retire at? What age for most of us in this classroom to get that PIA? What age, team? 67. Woo-hoo! That's correct. That's correct. Okay, very good, team. For most of us in the room, yeah. So if you retire early, what happens to you? What happens to this if you retire early? What if I retire at 62? How much of this am I going to get? And also, by the way, this assumes you work, 70. Yeah, you're getting 70%. Thank you, Catherine. Good job. All right, so you get hit on this if you retire early. You get a little bonus if you retire late. But that's how you calculate it. This is CFP-worthy stuff. So when y'all get out, know that this stuff is testable and fair game. This is my favorite slide in the deck, and it says, why you wait. If you take Social Security early, you're going to get penalized. Boom, boom, boom. Look at those penalties. Boom, boom, boom. They just add up. If you wait, look at the bonuses. They add up too. So when you factor in Social Security, the best and easiest thing you can do for your retirement is what? What's the best way you can get a little raise at retirement? What do you need to do? Right? You're going to get an 8% raise if you just what? I know more than Catherine's in the class. Come on, team. Although, Catherine, I do appreciate the enthusiasm. Thank you. What do you have to do to get a raise? All you need to do is delay, right? This ties right into the last 2 weeks' journeys. What Christine said, what David said, delay, 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 because delaying gives you a huge raise. 8% is a big deal. I don't get an 8% raise. Last year, I got a 3.5% raise, and I was thrilled, right? And I was thrilled at that. It's a lot of money. It's more than my spending went up. I mean, then immediately my spending went up, but that's how I roll. So an 8% raise is great. And if you have an age mismatch in a couple, let's say that you've got somebody who's 67 and someone who's 67 and 57. If you have an age mismatch and an earnings mismatch, then the absolute best thing you can do is wait. Because if you have an age and earnings mismatch, you have, let's say, the older person made more, then the older person's also going to die first, and that younger person can take this inflated benefit the rest of their life. And that's pretty darn cool. So delaying Social Security is going to be the bet most of the time. Taking it at your full retirement age as well. Now, if you're dealing with somebody who can't work, won't work, doesn't want to work, retiring early, great. But there's something called a Social Security earnings penalty. So on top of having a discounted Social Security if you take Social Security early, you also get hit with an earnings penalty. So I start docking your benefit for every dollar you make in the market. All right, so on top of this, if you take it early, you lose to the earnings penalty, which pretty much says for every dollar you make over $26,000, I get to take back half. So that earnings penalty is pretty rough. Every dollar you make over $26,000, I get to take 50 cents off your Social Security benefit. Man, that's a stinker. So you got to be careful with Social Security benefits from that end, because if you take early Social Security and then you go back to work, you lose your early Social Security, right? It's a stinker. So, you know, when we give advice to clients, look, when you draw this, you do not want to be working. And so we'll get into that here in just a minute, but that's how this works. Best slide in the deck right here. Okay. What else happens when I die? Well, you saw earlier on the slide what happens when you die on that first slide we got into tonight. But if you die and you're fully insured, there's something else. You get a shovel. Get a nice shovel from the Social Security Administration. You get $55 to buy a shovel. In 1938, when this act came out, what do you think that was for? What do you think this was for in the 1930s? What do you think, team? What was this for? 1930s. What do you think $255 would do for you in 1930s? What do you think it would do? Right? Mark, you got it, funeral expenses. But today, you're buying yourself a shovel. All right? So you do get this. You still can bury someone for $255. I think it's probably a little harder to do, but I imagine we could figure out a way. So $255 death benefit is thrown in the mix when you pass on. And we saw earlier on our chart that it pays for spouse preparing for kid, and then of course dependent single children. Now here's another thing about Social Security that's a little frustrating. Okay, team, pop quiz. What age does the dependent child get benefits until? At what age does your dependent child? If I drop dead right now, Lily and Ellie are going to get benefits. What age would they get benefits till? Pop quiz from earlier. It's on the big chart. Nope. Try again. 18. All right, very good. Now, my spouse caring for my child only gets benefits until, as Elizabeth said earlier, 16. So here's what this does. This creates a gap. This creates a big gap. And that gap is the time between when the spouse caring for your kiddos when the kiddos turn 16 and when the spouse gets to be Social Security age. There's a gap. And that gap is a tough one. Because imagine that your kiddos turn 16 and your spouse is 45. Okay? So spouse is 45 when the kiddos turn 16. And then the spouse doesn't get another benefit until they're 60, but they should really wait until they're 67. Right? So there's a huge gap there. And what do we use to fill that gap? What product can we use to fill that gap, team? What do you think? What can we use to fill that gap? We learned about it. It protects our human capital. What can we do there? Boom. Well, you could look at life insurance, right? Very good. And there's a term, and very good, Catherine, because it's a temporary gap. So we can count on this gap happening, and we can count on having insurance in place to provide a present value to fill the gap, right? And that's one of the things we do with life insurance. We fill this gap. And that's an important need of life insurance, because your spouse is going to get a check, the kid's going to get a check, and everyone's going to get a check, and they're going to think they're okay, and then the checks stop for 20 years. That's rough, okay? So you have to fill the gap. The gap is huge, the gap is real, and the gap is something we can plan for. So fill the gap, and we typically use life insurance to fill that gap. All right, very good. Disability benefits is rough. Social Security disability benefits are rough, okay? Mental or physical impairment that prevents you from engaging in any substantial employment. And my sister-in-law just happens to have worked for the in one of the Virginia district Social Security offices and Social Security courts as an attorney. And so she would write up court opinions on appeals, one way or the other, based on whether the judge ruled for. And it is very, very hard to get Social Security. Some courts are more sympathetic than others, but you have to show that you cannot work in any substantial gainful employment, and then they're going to follow up with you now and then. There may be, a picture taken and sent to court. So say, hey, they're ripping off the system. So you have to be very disabled in order to get this benefit. So don't count on it. There's a special provision if you did have sight and are now blind. So if you did have sight but you're now blind, there's a special provision, and then you can take Social Security disability. But there's a 6-month waiting period. It has to be at least a year-long disability that's expected to result in death. It's tough to get this benefit. So don't count on it. And what type of insurance do we use to help protect people from not being able to work because of an injury? What do we use there, team? We learned about it early on in the class. What do we call it? There's a short term and a long term, right? Maybe the easiest question I've ever asked, actually. Very good. Disability benefits. Yes, right? Long and short term disability covers that gap. So we buy it in the private market. And so where Social Security disability is any occupation, what kind of definition do we want? What do we want? What kind of definition? When we buy a private policy, what kind of definition do we want, team? What kind of definition do we want? I'm going to sit and wait till someone guesses. Any occupation is what Social Security is. What kind of definition do we want? ONOC, Mark, saving the day. Thank you. Own occupation. Remember that from our lecture early on? ONOC. Thank you. This is what happens if you work during Social Security. You start taking it on the chin. You lose $1 in excess of $2. I'm sorry, I had the wrong number there. It's $17,000. So you can make up to $17,000 while you take early Social Security. But after you make $17,040, you get hit with a penalty. You get taxed $1 for every $2 you earn. In other words, you're losing 50% of your Social Security benefit if you work before early Social Security. That's crazy. That's a lot. So you gotta be careful with that. In the year that you retire, in the year of your normal retirement age, we actually let you earn quite a bit more. So in the year of your retirement age, so let's say that I turn 67 in December, right? Then if I retire in January, I'm allowed to make $45,360 in the first 11 months of that year. Okay, so there's an earnings test applied to Social Security. And I'm allowed to work in that year I retire. So the year I turn 67, I can go ahead and say I'm done. I'm going to turn 67 this year. But the months before my birthday, if I work those months, I will be subject to the earnings test. I can just make a lot more. All right, the earnings test ends when you hit your full retirement age, which for most of you in this room is 67. So there's your earnings test. So this is even more the reason you encourage your clients not to take early Social Security. So look, you're working, man. But this also does give you some hope. If you do take early Social Security, you can make about $1,500 a month, a little less than that, and still be okay. So you can work part-time. So that's it for Social Security. Are there any questions about Social Security? How it works, what percentages? That first table should be very helpful. For those of you that are students in the class, this is on the CFP exam. You do need to know everything from that first table. You need to know how Social Security is calculated. I've seen questions on that. You need to know the earnings test. You need to know, if you haven't taken the CFP exam yet, you need to know this table. You need to know this one by heart because they don't give this one to you. So if you're a student, know that this is tested on the CFP exam. So this is important stuff for you to memorize before you go in there, okay? You need to know this chart, and you need to know the chart on the first page. At a minimum, you need to know what current means, you need to know what fully means. You need to know the difference between currently insured in survivor and currently insured for disability. All right, you need to know those things. If you know that, you're in pretty good shape. But this is tested, it's fair game, and so this is important both in the real world and advice and also in CFP land. All Right? It's important in both. Okay, so making Social Security decisions for people is critical because once we file Social Security, you know, we take that income for the rest of our life, and so it's important that we do that at the right time. All right, so I said there was a wage base on Social Security. There was no wage base on Medicare tax. So what does Medicare tax get you? Well, we're only 95% of Americans paying Social Security, around 99% paying Medicare. Medicare, again, you pay for with how much of your paycheck, team? Pop quiz, how much of your paycheck goes to Medicare? What percentage of your paycheck for most normal humans goes to Medicare? Most normal humans pay how much? Daniel coming in with the answer. Yes! 1.45% of employees, right? And then 1.45% for employer, and then an extra 0.9% if you're doing really well. Right? That extra 1.9% if you're doing really well, and that brings it up to 3.8. So Medicare Part A covers where you're at. Medicare Part A covers where you're at. So what Medicare Part A is, when you turn 65, you qualify for Medicare if you paid in, and 99% of us do. And it pays for where you're at. And where you're at is a hospital, right? Is where you're at. Skilled nursing is where you're at. There's other ways to get where you're at coverage. You can be married to a fully insured worker. So for whatever reason you never paid in, but your spouse did, you can get coverage once you're 65. If you've been disabled, you can get coverage. And if you have end-stage kidney disease, which is very expensive and requires constant maintenance to stay alive, you can be covered there too. What do you get? You get where you're at. You get hospital benefits. Okay, so you get 90 days per illness. 60 days are paid in full after deductible, and then you pay 30 with a deductible, and then you have a lifetime max for more days. But this pays for where you're at. You get 90 days in the hospital. You get a lifetime reserve of some more. Okay, so at any given time, you can go 90 days. And then you have a new event. You fall and break your hip, you can go 90 days. But this just pays for the room. It pays for the hospital room, the skilled nursing room, but it doesn't pay for the humans. Something else pays for that. So A pays for where you're at. The hospital room, the skilled nursing room, the home health care room. It also pays for hospice. If you have 6 months or less to live, according to a physician, it would pay for your hospice care, where you're at. A for where you're at. So here's how hospitals work in Medicare. For 60 days, you have to pay $1,040 out of your pocket. After that, the whole 60 days are covered in full. Then there's co-insurance. For the next 30 days, you have to pay, co-insurance pays $335 per day. And then you've got to do co-insurance of $670 per day for days 91 to 150. So you can see Medicare doesn't pay everything, but it does pay most of the things for where you're at. So Medicare Part A pays where you're at, right? So you pay $1,340 for the first 60. Then you have co-insurance $335, and then co-insurance goes up for your lifetime reserve. So as you can see right off the bat, Medicare pays a lot of things, but doesn't pay everything. And while most hospital visits are less than 60 days, the overwhelming majority, there are those situations where a hospital visit is longer. And so, you know, certain kinds of cancer, certain kinds of injuries are going to be a little longer there. Okay, so A, where you're at, pays for these things. Most of us pay into Part A. Part B pays for the people. Part B requires a premium. That premium is anywhere from, make sure I'm right on this. Give me 1 second. I looked it up before class, but for some reason I forgot. So I was right. So it's $134 a month for Part B premiums. So you have to pay $134 a month for Part B. And that Medicare Part B premiums then can index based on your AGI, and it gets higher depending on how much you make. So if you have high retirement income, that $134 is going to be higher. So Part B you opt into, but everyone should, because what's the point of a hospital room without a physician, right? It's silly. So Part B pays for the humans, pays for the physicians and the surgeons and the tests. So Part B you pay $134 per month, and that comes out of your Social Security check for Part B. So Medicare Part A is covered free while you work, and then you don't pay anything. Medicare Part B, you have to pay a monthly premium into Medicare Part B. All right, so Medicare Part B isn't free, so we want to plan for that in retirement. Okay, so that's Medicare Part B. All right, very good. Oh, nope, what's happening? Where'd my slides go? Okay, there we go. Woo, thought I lost you. Medicare Part C gives you the option of choosing Part C in lieu of A and B. So you can opt into what's called a Medicare Advantage plan. This is different than a Medicare supplement. You can opt into a Medicare Advantage plan if you live somewhere with quality health care. If you don't travel much, this may be a good idea. So these are a lot like the HMO or PPO setup. And what it does is allows you to pick alternatives, point of care systems, HMOs, instead of original Medicare. So you can say, I pick Medicare Advantage. Medicare Advantage is going to be in lieu of Medicare. You have a Medicare Advantage plan. Medicare Advantage plans can be more broad, right? You still pay some kind of monthly premium like you would with Part B, so you're paying something to have this. But if you don't travel much, it can be a really good thing. You can have doctors that you like. There's a network. They might be close to where you live, close to your assisted living center. Medicare Advantage plans can be very powerful tools to help people with their aging and health choices. But Medicare Advantage plans have a big disadvantage that they are limited to in-network doctors, and they also tend to be geographically restricted. So in those first years of retirement, when people tend to travel, this isn't necessarily the best fit. It might be later on, but in the first years, this isn't really going to work out well. So that's Medicare Part C. Medicare Part C you can opt into instead of A or B. It is not a supplement. There are supplements we're going to get to at the very end. But let's get into one more type of Medicare. All right, so I missed a couple of things on my cut and paste, so here we go. We're going to go to the whiteboard for just a moment. So you've got Medicare Part A, and what does A pay for, class? Hit me in the text box. What's A pay for? A pays for where you are what? A pays for what? Where you're at, right? So hospital, skilled nursing, where I'm at, okay? Hospice. What does Part B pay for? What does Part B pay for? I love it. It pays for the humans. It does, though. It pays for the people to treat you and see you. Part C is an alternative to A and B. All right. Now, Part D pays for drug coverage. And this is subsidized for lower income. It does have a monthly copay. With Part D, you can choose between numerous plans. So Part D plan pays for your drug coverage. Part A and B don't pay for drug coverage. Part D does. You can choose between plans. Every plan has to allow both mail order and walk-in access. That's Part D as in drug. Then we have Part F, which are considered supplement plans. Medicare supplement plans cannot have like coverage, no overlapping, but extend coverage. So Part F are Medicare supplement plans, and those offer extensions. Additional hospital days, additional care, cover the copay, cover the deductible, supplement plans. Now here's the thing for you, and if you get one takeaway from this class, please listen in. When you plan for your clients and your clientele, one of the biggest elements that's often missed is someone turns 65 and they get Medicare Part A and they get Medicare Part D and they find a drug plan. But if you're dealing with an affluent client, a retiree with multi-million dollars, find and get a supplement plan. Absolutely, absolutely. Right now, I'm coaching a very good friend of mine, and his mother has a very aggressive breast cancer, and she is 70, and she is on Medicare, and she does not have a supplement plan. And she has very quickly exhausted benefits and hit limits in Medicare Part A and B, and it is starting to get very expensive for her. And if she had a supplement plan in place, we wouldn't be having these problems, right? And this person, his mom has, plenty comfortable assets to take her through retirement, but here we are in a situation where, you know, the drug coverage isn't quite enough, where the Part B isn't covering quite what she needs, the Part A is starting to run into limits. So I can't stress enough, when you get into the real world and you start working with consumers, if they can afford it, get a supplement plan. Know them, know some good ones, and refer them to your customers and get them to buy them. It's absolutely worth its weight in gold. Okay, I can't stress that enough. This is one of those little things. This and umbrella liability policies. For the kind of protection you get, you pay such a tiny amount in premium, and you get so much protection. But these are areas that financial planners look over time and time again. We don't know enough about Medicare supplement insurance. We don't know enough about umbrella, and we need to consistently. All right, we run into these train wrecks time and time again where you have to have it. So that if you have one takeaway from this class, please let that be it. Learn about Medicare Part F. Learn about supplement plans. Learn some good ones. So when you get into the field and you work with a retiree and they turn 65, you're walking in the room and you're saying, great, you have A, you have B, there's D. Hey, this is what else you need. Okay. And on this end, I'm going to add one more type of insurance to this lecture, and that is travel insurance. So travel insurance pays when you go on a trip. And travel insurance pays for things like sudden medical costs, evacuation. Travel insurance is short-term. It pays for medical coverage and other costs. When you're working in the older community, travel insurance can be critical. One of the questions on the CFP exam when I was on the council that I'll never forget, it was about a cruise. And the cruise departed and where the cruise departed from. And so the cruise departed from Mexico, and it said, did Medicare pay if there was an accident on the cruise? And the answer was no, but it would have if the cruise left from the US port. Crazy is that? So the takeaway for you, though, is that Medicare pays most of the time, but doesn't always pay. So make sure you have you know, the right Medicare coverage, and if someone is going on a cruise from a non-US port, absolutely buy travel insurance. Heck yeah, you know, you have to. What if they, you know, they fall and break their hip, and then Royal Caribbean hits them for a $100,000 bill? You know, that's why you have to buy travel insurance. So think these things. You know, these things aren't always commonplace when you're working with retirees, but absolutely critical in helping secure someone's future and secure someone's health. So I can't stress enough how important it is. So you know, that's travel insurance, and again, just the little things that make a great financial planner great. You know, umbrella property casualty, travel insurance, Medicare Part F. These things we don't think of all the time, but they're the little pieces that kind of make that CFP professional, you know, on the top of their game. So I can't stress enough the need for understanding this, and you know, this class is a good one for that, social programs. So just kind of going back to the slides and popping that back, there's a couple more things I want to cover. Let me pop that back in. All right, here we go. Okay, I wanted to talk a little bit about taxation. So Social Security benefits for most Americans, only 85% of that benefit is taxed, right? Whoa, someone's having fun with that. Only about 85% of the benefit is taxed with Social Security benefits. So you know that that's a thing. So you actually get 15% of it tax-free. You want to look up travel insurance. The credit card travel insurance just usually pays for trip costs, not medical. So you want to make sure travel insurance that pays for medical costs. Great question, Harley. Thank you. But you want to look for travel insurance that pays medical costs as well. American Express offers a package that does pay medical and evac costs. That's what you'd be looking for. So look that up, but make sure it's the right kind. Taxation, Social Security is taxable for most Americans. There is an MAGI threshold for low-income Americans where it's not, but generally only 85% of your benefit is for Social Security. Medicare is not taxable as long as it just reimburses and doesn't make you wealthier. Disability benefits are taxable, right? Social Security disability benefits are taxable. Again, about 85% of the benefit is taxable. One last comment on divorce, fun with divorce, trademark. I'll write a book called that one day, Fun with Divorce. It's going to be a book about financial planning for divorcees because some of the like amazing stories you hear are phenomenal. And you're just like, man, I want to write a book about that. Okay, the links people go to, it is amazing. But, so what about marriage or divorce? Well, so if you're married, you can take yours or half of your spouse's, whatever's higher at your retirement age, right? You can take a look, yours or theirs. But the deal with if divorced, then if you're 62 or older and you're married longer than 10 years, you can go ahead and draw on your ex-spouse's record. So 10 years is kind of the number there. Remarriage is the dinger, though, because if you remarry under 60, then you lose access to your ex's record. If you remarry after 60, you can pick between current spouse, yourself, or ex. But if you remarry before 60, you shut yourself out of that earning record. So this actually changed recently. It wasn't too long ago that any remarriage threw out your ex's earning record. So it's only recently that we've protected spousal benefits like that. So anyway, Fun with Divorce, trademark. That's going to be my book that I write. But this financial planning and divorce is just amazing what you hear. But that said, that's really it for Social Security and Medicare. We talked about the benefits, the taxes. Everything you really need to know is on that first table. I think that, maybe pull it open real quick. Hold on. There's a little way to do this. Okay. So I think if you're studying for the CFP exam, this first table is critical. Know this first table. You want to know how it's calculated, because that's fair game on the test. And you want to know the penalties and bonuses that come in. Those are the key tested elements CFP exam-wise. In real life, go back to that whiteboard slide I did. I don't care how rich they are. Supplemental Part F is going to be worth its weight in gold, right? Worth its weight in gold, Supplemental Part F. And I can't tell you enough, again, those are the little things that you knowing Part D, you knowing Part F are just going to wow your employer, and they're also going to wow your clients and keep them safe. So that's pretty much it for me tonight. It's not a horribly long bit of content. It's just very important content.